I didn't really think I would have it when I got tested over at one of our medical clinics, because the only symptoms I had were loss of sense of smell and taste. I was asymptomatic. I didn't have the other symptoms that other patients may experience. I didn't have the shortness of breath, the chest pain, the high fevers, anything like that. So one morning, I just wanted to know why I suddenly lost my sense of smell and taste. So I went to one of the clinics and they told me that that's actually a new symptom of the COVID virus. So I was a candidate for the test. And after that, they called me that evening and told me that I did have a positive result. So the fear, the constant thinking of what am I going to do next? What's my next plan? How am I going to help my family? How long will quarantine be? What's my duration of, will I start showing symptoms throughout this whole time? But thankfully, I only just had the loss of sense of smell and taste. I was blessed enough to not experience serious symptoms. So I was locked up in my own room. I had my little corner right outside my door with my own personal things, paper plates, disposable utensils, cups, my own toothbrush. And anytime that I needed to step out to use the restroom, I had to tell my family, like, hey, I'm going out. Please stay away from me. And then I have to disinfect the restroom right away, tell them to wait about 30 minutes to an hour before they could use it, just to keep them safe. I know when people hear that they've contracted COVID, the first initial thought is, am I going to go to GMH? Not necessarily. If you're not in severe respiratory distress, you can stay home or you can be transported to one of the positive locations that public health offers. My experience at home was rough. You know, I'm a very outdoorsy person. I have a cat. I garden. So it was very hard for me to stay in my room for 2 weeks and then just lay there and have these thoughts of, when am I going to be okay? How long will I be okay? Well, what's the outside world like now, knowing that I've been isolated in my room for 2 weeks? I would say public health did a great job keeping me up to date, calling me twice a day, one in the morning, one in the afternoon, asking how I'm feeling, asking if I have any new symptoms, and then asking me and my family if we needed something since we're going to be homebound during the quarantine time. So with them asking if we needed food or anything outside, and then they were willing to help us, that was such a big blessing to public health to do. It felt great coming back into work. You know, I'm ready to be a frontliner again, helping the community of Guam, educating our island, you know, letting them know that you can experience some of these things, and if it does, don't be afraid to reach out for help. Don't think that you're alone, because you're not. You're not just one person, you know. If you need the help, feel free to contact your provider. Feel free to contact public health. Call whoever you think you may need help, and even if you call the emergency room, we'll help you. We'll guide you to the right number so that way you can get properly treated.